In the House, it is the Speaker of the House, Jason White. Good morning, sir. How are you? Thank you for coming in. Appreciate it, sir.
I'm good, Paul Gallo. How are you?
Man, it's been a busy week, is it not? No working tomorrow, are you?
Oh, yeah, we're working tomorrow.
Tomorrow, Saturday, it's time of that time of the year.
Yes, sir. I was hoping we could
Sunday too, or
Sunday as well. I was hoping we could avoid it, but looks like we're gonna be here.
What's the majority of stuff that we've got to get at? Are there the appropriations and all of that's taken care of?
Well, it's in the short rows, but we're getting closer on all of that on the appropriations part. But we still got some big dogs laying out there with our education funding rewrite and Medicaid laying out there.
Let's talk about the big dogs
and PERS.
Because we get people writing different stuff, and it's good to hear from the newsmaker himself or herself. Let's take them one by one. The Inspire versus MAEP. Where do we stand on that one, and put your thought process into how we're going to get this thing done?
One of my favorite movies is Young Guns, Paul. You remember when Emilio Estevez, they asked him something about, he said, "Hey, Sheriff, I hear you got Charlie so-and-so with you." Mm-hmm. And then he shoots Charlie, and he says, "Charlie ain't with us no more." That's kind of where we are with MAP.
Well, we've been talking about the switch all morning. I hope this doesn't lead to that.
No, it doesn't lead to that. I'm just telling you, MAP is not going to be with us anymore come July 1st. So we've gotten over that hump, and now we are. The Senate finally got inspired on an education rewrite. They sent us a rule suspension yesterday, saying we are suspending the rules for deadlines as it relates to introduction. They want us to introduce a brand new education rewrite bill. It's got all the features of our Inspire bill, but they want to introduce a new bill that does away with MAP and basically writes the Inspire formula into a new bill. So you will see the House drop. We will pass a rule suspension probably today because we're past deadlines, obviously, and we will introduce basically our Inspire bill. They wanted a little more added to the base student costs as far as the way it's arrived at. So I'll give them credit. They were reasonable on how they wanted to do that, and so they finally came to the table, and looks like we are going to get a funding formula rewrite. So it's a good day for public education in Mississippi. Probably lead to $200 million new dollars, and they will be fairly and transparently distributed throughout the state to all of our public school districts.
Let's talk about the timetable for this. Can that? You think that can be taken care of today, or by this end of the weekend?
We'll probably pass the rule. We'll probably pass the rule suspension on our end today. Mm-hmm. They passed it yesterday.
You think anything? You guys going to change anything in your conference, or to change it to send it back to them? Or
no. It'll be a House bill. We'll actually drop the bill, so it's not to send back to them. We'll actually. After we pass the rule suspension,
and then the process is they've got to concur with that.
That's right. They'll have to pass the bill that we send to them, and then it would go to the governor.
All right. So you anticipate putting anything in there that they will reject?
No, sir. Like I said, they have seen the light, and we're glad of that.
All right.
I welcome them.
Will the name be the same thing as Inspire? Are you going to change the name?
I don't know. If we don't hurry up and get it done, we may call it Expire because I've been fooling with it so long. So we don't really care about the name. If they want it not to be the name Inspire, and that's fine. I'm not going to get hung up on names.
Is that right? So it can't be that elementary. I mean, that's petty.
Unfortunately, that's where we are, Paul.
Are you serious? You're telling me that they don't want to brand it a name that you guys chose?
Yes, sir. But it's fine. Hey, my people are good. Look, we're going to get the meat and potatoes, and that's what we want.
Did they suggest a name?
No, sir. No, sir.
All right.
I know, but look, you got to keep your eye on the prize, and the prize is an equitable funding formula.
Let's get past that and go back to what you said, the change on some of the formula. Can you go over that, what we're talking about? Would the schools that need it the most be less better off, or about the same?
They will be better off. Mm-hmm. And the other thing is we're doing away with this hold harmless stuff that's been deeply rooted in MAP at least since 2002 or 2003, and that is schools lose students, schools don't do certain things, and we continue to prop their funding up as if we're funding one school in South Mississippi that's missing 500-600 kids, but we keep funding them just like they're there. It's called hold harmless agreements, and they're all throughout the MAP funding formula. And I'm oversimplifying that a little bit, but suffice it to say, they still get their money as if those students are there, and they're not there. Those school districts have been shrinking, but we still prop them up and fund them as if those kids are there.
Yeah, but you wouldn't do that in the private sector, though, Mr. Speaker. I mean, it would be like continuing to have a maintenance division or maintenance column as far as funding for typewriter maintenance. I mean, sooner or later, you're going to redo this.
Obviously,
it's crazy. Look,
if we could get more like what happens, in a private business over there at the Capitol, we'd be a whole lot better off.
All right, so it seems like
the funding formula gets it to the schools. Mm-hmm. It funds all public schools, and I say it does it fairly and equitably in such a way that certain places where they say we have been underfunded, and that is why we are chronically failing. This will actually it puts $15-20 million more dollars into Hinds County schools, and we actually had Hinds County reps not be for the formula to begin with. They're now on board as their constituents, and school superintendents have called and said, "What are you doing? This is about us." But look, to whom much is given, much is expected. They're going to have the money now, and we're going to see where the results. Are those schools going to remain F schools, D schools, C schools, or are they going to actually move the needle? And you will have a set of data in about 4 years to say, we fully funded those schools. Now, what did they do with it?
You just answered all the questions I have, because now that they have this, if they're failing schools, and they're traditionally failing, something else needs to happen.
And something else will happen.
Is the next thing, as far as next year, taking a look at some modicum at a serious basis? I know the states around us are doing this on school choice. I know that didn't get a grip this year, but maybe next session?
Look, it is. But I want to be real clear about this. Some folks, that was what they used against the Inspire Act, was said, Jason's for school choice, so if he's pushing this funding formula, there's got to be a snake in there somewhere about school choice. Mm-hmm. While this funding formula does fund it based on each exact student's needs. I mean, we have weights. Every student, if Lance was a student at Murrah High School over here in Northwest Rankin, he would get a base student cost plus weights for the different things that might pertain exactly to him as a student, whether he was gifted, Paul, whether he was in CTE, whether he was in SPED, wherever he was.
Yeah,
those things would be added, and you would, boom, there would be a number attributed to Lance. That's how it'll be for every school, every pupil in the state of Mississippi. So with that in mind, people said, they're trying to tie it to a student. That's leading to a school choice bill. It's not leading to a school choice bill, but totally separate from the Inspire Act funding formula. There is a movement for school choice, not just in Mississippi, but throughout the country. And I think we would be, sticking our heads in the sand to say, we're not going to try to find a way to get there. I'm for it. I will tell you, a lot of folks talk about it, but not a lot of folks are actually for it when it comes time to write a bill and vote on it. So we're going to continue to push that because parents and taxpayers demand it. That's why, not because I had a crazy idea or somebody else did, but because parents and voters are saying we want the choice. So that's going to continue to be out there.
The lobby against this and the powers against having total control on all those dollars is powerful. Not only in Mississippi, look at Tennessee. Tennessee's movement was going full blast. You thought they're never going to be able to derail this. And at the last minute, they had to kill school choice there in Tennessee.
They did.
It'll be back next year, as you well know. Well, I do want to go back on one thing, though, because we've been dealing with this. And again, Jason White, speaker, is with me. We've been dealing with this for a long time. To the fallacy or the weight you're talking about on some of the equations on all of this depend on who's in school and who's not in school. How do you count somebody as present? And in going over this for years and years and years, every school had a different way of doing this, and it was just ridiculous. Has that?
Yes.
Is there some tenacity now in this?
Yes. That is a main feature of the bill.
Would you hold and answer that when we come back?
Yes, sir.
All right, we'll do that when we come back with the speaker. For folks that don't know and haven't been with us for a long time, on some of the ways that this school here might say if a student comes by and waves, we'll count him as here. The next school, if a student comes by and he's in class for the first class, he's counted as here. Some students had to be in for half a day, and they're counted as here. So it was just a lot of different ways that they were counting this, and it made the overall product kind of useless, to be honest with you. A little educational music. Back in a moment with more. Friday in the house on the SuperTalk Network and the Gallo Show is Jason White, Speaker of the House. All right, we were talking about the integrity of the actual numbers for attendance.
Yes, Paul. Now, MAP, the way MAP does it is they basically take who walks through the door as being in that school. They do an average daily attendance. In other words, people that walk through that door in those months, they count them, if you will. The way the Inspire formula or the no-name formula, the new one will be, is it'll be average net enrollment of months 2 and 3. So we're going to actually see the kids that were enrolled in the district and there in the second month of the school year and in the third month, and average those together. So you're not going, if kids were there the first week, or you thought they were coming and they had moved over the summer, and, you're not going to be counted for those people. You're going to actually see who is enrolled and there in months 2 and in months 3. You're going to measure it twice and then take the average, so that you've got a real number there of people that are there. Because people do flow in and out of the system, especially, when you're talking about 300,000-400,000 kids throughout the state. Yeah. There is attrition, and folks move around and that sort of thing. So at some point you've got to stab the number. But we're not just going to say, okay, anybody that was there, if there was a body there on a particular day or this particular day, that's the number. We're going to actually take a more captured look over 2 different months and look at enrollment.
This has nothing to do with it. I'm just curious about this. In talking about school choice and maybe going public school to public school, and I know we can do that now, but it's a headache doing it. Will this make it harder or easier? Is because butts in the seats were always the big deal, and people fought over them because of taxes, not so much of what's good for the kid and the family. It's what's good for the front office.
Look, it is about butts in the seats.
Yeah.
I mean, that's how they get their money. And so,
But if they're failing,
a lot of them are. But let me say this: a lot of them are doing very well. So nobody wants to undo all the gains that we have made. And I'm going to be the biggest cheerleader for some things that we have done in our K-12 public schools. I have to brag on that because they've done a good job. Now, there's still a ways to go, and there's still things that we need to do, and a lot of that does center around parents and what they want for their kids. But that was something in this new formula. We have got a very large weight for career and technical aspects for schools. In other words, if you've got a student in a school district who is going to take part in career tech, we want to weight that and give you extra money for that because we want to incentivize that. And for a long time, we have not done that in our public school systems. Now, the more dynamic school districts did it because their taxpayers and school boards demanded it. So their curriculums included a very robust, we used to call it VOTEC, but now it's called Career Tech. We're wanting to push that throughout our entire K-12 system throughout the state. So we have a weight in this new formula specifically for that, and it's a fairly hefty weight, somewhere between 10 and 20%. Weight that gets thrown in there for that. So we're going to incentivize that. There are things we can do better, and career tech is one of those.
All right, because we got so many other things to talk about. The synopsis on this is that you guys are going to be meeting over the weekend, today and the weekend, and the Senate has done a rule suspension. So it really basically is the Inspire bill is intact with some minor modifications.
That's correct.
And it'll go through the process this weekend.
Look, and I'm glad they're at the table and we're going to finally do this. So don't take my comments as if I'm bashing my Senate colleagues. I'm excited for Mississippians. I'm excited for school districts throughout the state that we're going to have this conversation this weekend, and they're going to have a product that everybody's going to be proud of.
All right, let's talk about the other one. This is so much easier. It's Medicaid. Where are we with the Medicaid as of today, right now?
Well, I won't rehash everything that got us here because you you've been involved and plugged in and know all about it. But we passed a bill that went up to 138% of the federal poverty level. It had a work requirement, but if the work requirement is struck down or not approved by CMS, our program goes into place anyway with some guardrails, including a 4-year repealer, including if they change any aspect of the reimbursement model, it goes away. By doing that, the state also draws down almost $700 million during the first 2 years that can be spent on anything. We have ideas about our mental health and about career tech and about recidivism in our corrections system that we want to put that money toward. But again, you only get that money if you go to 138%. All right. All of those are great things, but that's not the reason to do it. The reason to do it is because it won't save every hospital, but it'll cut down on uncompensated care, because these people, whether anybody wants to admit it or not, they still seek care. They just go do it in an emergency room in an uncompensated scenario where they don't pay. So they're still not going to pay for their health care. It's just we're drawing down a 90-10 match from the federal government to pay for their health care in hopes of them seeking some preventive care instead of just showing up at the emergency room, not paying, getting treated, and it's baked into your premium, Lance's premium, and my premium on our insurance. And that's the way it works. They have to see those people when they show up at their ERs. All right, we're if not the most unhealthy state, we're right there at the top. We could do better as a state in that area. And it would help these people, these low-income workers, maybe see a path out of there. I want to remind everybody, nobody's getting a check for this. They're simply getting some basic health care. Now, yes, it comes with a price tag. Mm-hmm. Our bill called for our managed care organizations that will manage that population to pay a tax to cover most, if not all, of the state's share, which is 10%. The Senate didn't take as robust position on Medicaid. Their bill only went to 99% of the federal poverty level, which doesn't get you the attractive 90-10 match from the feds.
Yeah.
It doesn't draw down the enhanced reimbursement on the rest of your Medicaid program that amounts to about $700 million. And yes, those are carrots to get you in the pool, so to speak, and that's why the feds designed it that way. But here's the last catch nobody is acknowledging really. 40 states have expanded Medicaid. We're not going back. The country's not going back. 20 of those states are Republican states that voted for Trump. 20 of them are Democrat, blue states. We have a Congress, Paul, that can't agree on an Easter holiday proclamation. They're not going to be able to get together on major legislation like this and repeal the entire thing. We've got to figure out a way to skin this cat.
Let me say this.
Let me say this, though. You asked where it is. Mm-hmm. The Senate we presented our plan to them. Our conferees presented our plan to them this week. They presented their plan to us. They were worried about the people that are already on the exchange. Guess what? Receiving a federal subsidy. All that money's coming from the same bank account where this would come from. We simply want to get the 90% from the feds. So we said, hey, we'll change our plan and we'll cover the 100 to 138 on the exchange, like you're saying is a great thing for the folks that are already there. They'll just actually have a better policy without these high co-pays and high deductibles. So we would cover up to 99% like the Senate wants to do on a traditional Medicaid, and from 100 to 138 we'll put on the exchange. So that we think we've got something there with the Senate. We've still got to talk about the work requirement and figure out exactly how we're going to do that. But hey, I'm encouraged by the talks.
How many people do we have working already, though, when we talk about this? Because I think it's viable to say, look, if you're gonna get this from the working people of our state, you need to also be working. How many of those people are in the plan? Do you think are already working?
Everybody agrees that these recipients should be working. What I would tell you is,
or community service. Most
of them are. Here's how we know that. They don't qualify for anything else. They don't qualify for benefits. They don't qualify for Medicaid. They're not getting a disability check. If they were getting any of those things, they would already qualify in one of the categories. So whether they're making $10,000 a year, whether they're on the cash economy, whether they're cutting yards, washing cars, it's tough to measure these people. They're a cashier here today, and they're working at a restaurant here tomorrow, waiting tables. It's tough to track them and rate them, but if we get the program, we will do that. We will charge our MCOs over this 4-year period to compile every bit of the data, and we'll know exactly how many people are working.
Who gets the $350 million per year for 2 years?
The state of Mississippi.
You can use that anywhere you want it.
Yes, sir.
Mental health.
Yes, sir.
Roads.
You can use it anywhere. I saw North Carolina was doing a combination of beefing up their mental health, doing some things with career tech. Like in other words, these beneficiaries, if they're not working, they've got to be full-time enrolled in a career tech.
All right. One other question real quick. How much of that 10%, what are we talking about from the general revenue for whatever the tax doesn't cover that 10%?
Well, at least for the first 4 years, it wouldn't cost the state a dollar. The total amount, if you weren't taxing MCOs, is a little over $100 million.
But long term, what are we talking about?
We don't know. That's why our bill had a 4-year repealer, and it goes away at the end of 4 years. But again, the projections are 100 to 137 million would be the state's cost. But between the MCO tax and the federal dollars you draw down, it's almost a zero to the state. So it's almost no effect.
If you don't mind, final segment, let's go over one more time the process that has to take place this weekend, where that is as far as Medicaid, because those are the big ones. And then, of course, it's the possible veto. That's the 75-pound tater in the produce bin there. So more coming up on that next. Jason White, got limited time here, and I'll let you finish out the process this one's going to go through, since you guys probably are going to be working this weekend. What does it look like? What happens now?
All right, process-wise, Paul, you mentioned budget right when we came on the air. Those bills will have to get conference reports filed, and you know this when you've passed a bill in each chamber, whatever it is, whether it's Medicaid, Ed bill, or even a budget bill. When you can't agree, like when you pass a bill and the other chamber passes it but changes it a little bit, they can invite what's called conference, and that's where all these people are. And traditionally, this is called conference weekend because it's where things live or die finally. There's a deadline for general bills of Tuesday. In other words, if a conference report is not filed, if conferees from House and Senate hadn't signed a conference report saying, hey, we have an agreement, here's the agreement we have on this bill, and we file it, that has to be done by Tuesday for things like Medicaid, for things like education rewrite. But now that we've got a rule suspension on education, it doesn't have to happen by Tuesday, but it probably will anyway. The spending bills, the revenue and appropriations bills, those will have to be filed tomorrow and then voted on probably no later than Monday. So you'll see all of that stuff start wrapping up from a timeline standpoint. Here's what I want to tell you. The last thing I want to say about Medicaid. Nobody is pitching Medicaid expansion as the perfect health care plan and solution for Mississippi or even our country. But it's the one that's here, and there's not another one coming. And here's what finally turned the tide in the Mississippi legislature, which is wholeheartedly controlled by supermajorities of Republicans. The business community in this state finally started weighing in on the issue. We now have letters of support and public comments from Mississippi Economic Council, the State Chamber of Commerce, from BIPEC, from MMA, from all these important business groups throughout the states who lobby and, wrangle for creating the best business climate our state can have. They are finally now saying, guys and girls, it's time to do this. It's the smart business thing to do. And here we talked about running government like a business a while ago and talking about MAP and looking at school districts and things like that. That's what got my Republicans to the table on this issue, Paul, is it's time to be smart about it and not be hung up on all the other political hot button, sound bites that can come from saying, I'm against Obamacare. We're all against Obamacare. But it's what's here, and it's the world we've got to live in. So I'm saying once the business community got behind this, folks start having real conversations, and it looks and seems like the smart and right thing to do for our poor, unhealthy state.
I think one of the things everybody's worried about, that number that we have more people who can work or not working, that's a number that this is not going to help unless it's done the right way.
This is not going to change that. Let me say this. This is not going to change that. It has not changed it in other states.
All right.
We got major work to do there with our labor force participation.
The other thing is the final outcome. We talk about 4 years, and then there are a lot of people saying, wait a minute, I know politics. In 4 years, you're not going to get time for another election to pull insurance from 100,000, 200,000, 300,000 people.
Well, our bill said you would have to have full 3/5 votes in both the House, Senate, and withstand the governor's veto again in 4 years. No, but we weren't pitching it. This is the greatest thing since sliced bread. What we said was, let's run a pilot program for 4 years. We know it doesn't cost us a single dollar for 4 years because of that almost $700 million that's coming in. That, we talked about things we could do with it. One of the other things we've offered to do with that enhanced match at almost $700 million, we'll set it aside to pay any of these potential cost overruns.
You said it's coming in 2 years or 4 years?
It would come over the first 2 years. You would get about $345 million the first year and about $345 the second year, somewhere around that much. And again, that's outside of the expansion program. That's just enhanced match coming based on the $7 billion program that our state Medicaid programs are.
Is all this beginning in fiscal year if the governor doesn't veto it or lets it become law without signing it? Does this become fiscal year July 1st?
It would go into law July 1st, but
then you have to have the enrollees, and it's going to take time.
Yeah, and you would have to get a waiver from CMS because we're not doing traditional Medicaid expansion. So you would have to go to CMS in D.C. and apply and get a Biden administration to grant your waiver, which is going to be tough to get. Everybody's fully admitting that.
So it's got to get by the waiver. It's got to get by the veto. So the chances are still not written in stone here.
That's correct. We're a long ways from the finish line.
Well, one thing for sure, though, if for some reason we clear this with the Republican majority, and we sine die with this happening on both of these two issues, taking those two issues off the table for what's left of the liberal media in the state would be like them being neutered and spaded at the same time. I don't know what they'll have to talk about next session. So. I wish we could get to more stuff. We certainly would have to, like PERS. We didn't get to that. Real quick, any 10-second thing on PERS?
Looks like PERS legislation features were included in the Senate's rule suspension yesterday. So that debate continues to rage on. I think there's some consensus around we're going to pause the employer increase that PERS board voted in, take away their escalation authority. It'll be with the legislature from here on out. We'll probably give a very small increase, like a 0.5% increase over a 5-year period, and there will probably be some cash infusion of taxpayer dollars this year, and create a fifth tier for new employees
you heard
as we move forward.
Thank you, Jason. Appreciate it, sir.